Hi, I'm Bill Crawford. I'm in my gym, basic training in Scottsdale, Arizona. There's been a little confusion about the MedX medical machines, how they work. So we're going to try to explain them to you in detail so that you have a better understanding of what they are and how they work. So this is the MedX Medical Lumbar Extension Machine. And what it does is it isolates the paraspinal muscles of the lumbar spine, and it trains them in isolation to make the muscles stronger that support the vertebrae in your low back. So Arthur Jones, the fellow that invented Nautilus, he believed that muscles respond much better to exercise if the muscles are trained in total isolation through their full range of motion with equalized resistance. It took him a long time to figure out how to stabilize and isolate the erector spinae and the paraspinal muscles of the low back, but this machine here is what cracked the code, and I've seen this machine work miracles over and over and over again. There's an elaborate system of straining devices. So you sit in the machine, there's a belt that goes across your femurs, this goes across your femurs, your feet go on this platform, we turn a crank and that pushes the platform towards you, pushing your tibia into your femur and driving the femur into the pelvic structure and stabilizing it against those roller pads so that when you go into flexion and extension, it forces the isolated contraction of the paraspinal and erector spinae muscles in your low back, working those muscles in total isolation. Nothing else will do that. Inside the machine is a potentiometer that will measure your range of motion, and there is a force meter that will measure the amount of force produced by muscular contraction at several different angles of the range of motion. So it's also called a load cell. The load cell measures force in foot-pounds, and so we'll take this machine and we'll lock down the movement arm through several different segments of the range of motion, and then we have you perform a static strength test where you push and it measures the force that you produce at each angle. That's then converted into a lineal graph, and we can look and see if you have a normal strength curve, an abnormal strength curve, and we can do a comparative analysis to see if you're average, above average, or below average. That's the value of the static strength test. It gives us a baseline, and we can store that test and look at it later, and we can compare and see how much progress that you have made. Also, the machine is capable of doing dynamic exercise. So there's a formula that we use that we can determine the exact amount of resistance that should be used against your spine and your back muscles when you're pushing up against it. That's called the load factor. So there's a weight stack on here, and so we can adjust the weight so that's exactly the right resistance factor, and then you go back and forth with a dynamic exercise, and that is what strengthens the back. When the back is strengthened, it supports the bodies of the vertebrae. Many times that'll take the pressure off of the discs. The other thing that it does is when a muscle goes into spasm, it squeezes all of the vasculature within that muscle group, and it deprives the muscle of oxygenated blood. When you deprive a muscle of oxygenated blood, all of a sudden that's where the pain comes from. That's painful. Doing this exercise through forced repetitions in total isolation pushes massive amounts of blood through that muscle tissue, and that will give most people immediate relief from pain of the low back. So this machine, we use it all the time. It's a great machine, and we've got a lot of confidence in it. We've never had any problems with it, but we have seen this machine work miracles over and over and over again. This machine is the cervical neck extension machine, and it works off of the same principles as the lumbar machine. You sit in here, you're restrained, so that there is no movement in the torso, the upper torso, and that forces the isolated contraction, a movement of the spinal muscle in the cervical neck. And so we can isolate those muscles, we can train them, we can test them, and there's a lot of times where people have lost range of motion. They have other issues, nerve damage, which affects the movement of your extremities in your arms, and we find that if we can strengthen those muscles, supply blood to them, and get the pressure off the bodies of the cervical neck vertebrae, a lot of times that resolves the issues and people can be pain-free and that can restore their range of motion. So the next machine is the one that we've had so much confusion about lately. This is the cervical rotation machine, okay? So a lot of times people lose the ability to rotate their head, their neck, and we see them all the time. They've got to twist their whole body to look over their shoulder. They can't twist, they can't turn, they're in a lot of pain. And over time, those muscles, they seize up, they lock up. So it limits your body's range of motion. So in this machine, we can test your range of motion on both sides, and then we can determine what is the effective and safe range of motion that we can put your head in. So the machine goes all the way to 84 degrees, center, 84 degrees on the other side. So if we find out that your range of motion is limited to 42 degrees, there's a hard stop on the machine. You can go to 42 degrees on the other side. That's your range of motion. That is the parameter of range of motion that we can test in and exercise in. So just like the other machines, there's a potentiometer in here, which will measure your range of motion and document it. There is also a force meter that will tell us how much strength that you can produce in inch pounds through different segments of the range of motion, and we can build a graph, and we can also compare the right side to the left side, and that's very helpful when we're trying to determine what the exercises should be to bring back range of motion and restore health to your cervical spine. So this machine does not move itself. It does not have a motor in it. What happens is you sit in this machine and we put pressure on your head, put pressure on your chest to stabilize everything so there's no other movement, there's no impact force that can produce problems, and you actually twist your head against the resistance of the weight stack that we have selected for a resistance factor. And what that does is it pushes blood into the muscle, it stimulates your blood flow, and it also increases your range of motion. And a lot of times these muscles, once they get blood and oxygen in them, it restores lost movement. It's restorative when it comes to range of motion. It's a great machine, and I've seen it work miracles over and over and over again. It's very expensive, and you have to have a lot of training to be able to use it. Arthur Jones, the guy that invented Nautilus, invented all of these machines. They were tested at the University of Florida, the Exercise Science Department, extensively. Also at the Exercise Science Department at the University of California at San Diego. They've been placed all around the world. They've treated thousands of people. I don't know of any adverse effects ever. No injuries, no problems. So hopefully this helps clear it up. If you want to know more information on these machines, visit www.medxonline.com, and you can see white papers that have been written on these machines, and hopefully that will clear up other questions that you might have about the machines and how they work. As well as the cervical, neck, and lumbar machines, we also have the MedX knee machine, which is a fantastic rehabilitation machine for the knee. And in just a moment, I'm going to show you the thoracic machine. This is the Rotary torso machine, and it concentrates on the thoracic spine. We've seen this machine reverse scoliosis, which is really a muscular problem. In most cases, it's not a skeletal muscle issue, or not a skeletal issue. The muscles just get weak and they don't support the skeleton as they should. So if we strengthen those muscles, we can restore natural posture to the thoracic spine. Also, if you're a baseball player, a golfer, a tennis player, this puts so much power in your rotary torso movement. The athletes that we train here have had incredible gains in their range of motion and their strength factors using this machine. So as well as our medical machines on this side of the gym, we are pleased to be able to provide some of the very best older Nautilus equipment. This is where I do most of the one-on-one training. And then if we go over to the other side here, you can see our collection of MedX equipment. We have every single piece of MedX strength training equipment that was ever made, and it just happens to be the absolute best strength training equipment on planet Earth, available anywhere at any time, at any price. So we train people how to use it. Here you can come on your own. You don't have to be subjected to expensive group training sessions. Once you learn how to use this equipment, you can come and use it anytime you want. So thank you for watching this. Hopefully this will clear up any questions that you might have. And I'm here in Scottsdale for